Health info. Bringing you well-researched medical information. What is gestational diabetes? Do you know? Gestational diabetes impacts around 10% of pregnancies in the United States each year. Gestational diabetes mellitus, GDM, is slightly different from type 1 or type 2 diabetes. Gestational diabetes may occur during pregnancy and ends after the delivery of the baby. GDM can happen at any stage of pregnancy but is more common in second and third trimester. In gestational diabetes, the placenta secretes a hormone that hinders the body from efficiently utilizing insulin. Our pancreas produces the hormone insulin, which functions as a key to allow blood sugar to enter your body's cells for use as fuel. Glucose does not enter cells but rather accumulates in the circulation. Compared to type 1 diabetes, lack of insulin is not the cause of GDM. Instead, the other hormones produced throughout pregnancy might reduce the action of insulin, resulting in a condition known as insulin resistance. The need for insulin rises as a result of insulin resistance. In late pregnancy, insulin resistance is a common occurrence in pregnant women. However, some females already have insulin resistance prior to conception. They require more insulin at the beginning of pregnancy and are more likely to develop gestational diabetes. During pregnancy and after delivery, gestational diabetes can harm you and your unborn child. However, the risks can be significantly reduced if the problem is identified quickly and is well controlled. Which women are at risk of gestational diabetes? Any pregnant woman can develop gestational diabetes. However, the risk is higher if BMI is more than 30. If the patient had a previous baby who weighed 4.5 kilograms or more at birth, or if there is a family history of gestational diabetes. Symptoms of gestational diabetes. Symptoms of gestational diabetes are minimal. The majority of cases are only identified by blood sugar monitoring during gestational diabetes screening. Some symptoms that expecting mothers can experience include increased thirst, dry mouth, need to pee frequently, and a feeling of tiredness. How would you know you have gestational diabetes? Your midwife or doctor will likely ask you some questions between weeks 8 and 12 of your pregnancy to check if you are at risk of gestational diabetes. You should be given the option of a screening test if you have one or more risk factors for gestational diabetes. An oral glucose tolerance test, OGTT, which takes around 2 hours, is the screening procedure. Otherwise, you'll likely be tested between 24 and 28 weeks of pregnancy because gestational diabetes typically appears around the 24th week of pregnancy. The likelihood of experiencing complications during pregnancy if you have gestational diabetes can be decreased by managing your blood sugar levels. Blood sugar levels may be reduced by changing your diet and exercise routine. If these modifications don't sufficiently lower your blood sugar levels, you will also need to take medication. It could come in the form of medication or insulin shots. Keep a mindful check on diabetes symptoms to prevent any complications. Keep watching our videos to learn more about diabetes. If you like our videos and want to learn more, please leave a comment below, subscribe and share to help others.